Hi, I'm Dr. Vishal Vikas Nair, and today we'll be seeing how to find landmarks in nasal polyposis. So, as you can see, that we have polyps in the middle meatus. I can't differentiate the middle turbinate here. So, we take a microdebrider or a shaver and start debriding the polyps. The important point here is you should allow the tissue to be sucked into the debrider and then start cutting. The cutting edge of the microdebrider should always be in view, and you should ensure that you're not debriding the septum or the lateral nasal wall accidentally. So, the most important landmark in FESS is the middle turbinate. And so, you debride the tissues slowly and try to find your middle turbinate or define the middle turbinate if it has become polypoidal. So, slowly from inferior to superior, I'm clearing all the polyps. And as I reach the olfactory cleft, I carefully, slowly debride the polyps. Again, I reassess. Allow the tissue to fall into the debrider blade and then start debriding. Always ensure that the cutting surface is away from vital structures and debride only the polypoidal tissue. So here I can see polyps that are medial to the middle turbinate as well. Now I'm trying to locate the middle turbinate. So one of the tips that I was taught is always try and trace the middle turbinate from its posterior edge. And once you get that, everything anterior to it can go. So as you can see, this is the posterior end of the middle turbinate which attaches to the palatine bone. And now we have starting to define the middle turbinate. We can see the glimpse of the polypoidal bulla as well as the uncinate process coming in view. And so now everything in front of it can go. So I would like you to appreciate how the cutting edge of the debrider changes directions, and I haven't traumatized any part of the lateral nasal wall or the septum, which ensures that there are no synecdoche or adhesions which are formed later on. So as you can see, we have the bulla in view, we have the uncinate in view. To control a little bit of bleeding, I'm putting a pack in the middle meatus, and now we can get a clear glimpse of the uncinate, the free edge of the uncinate. I also got a glimpse of the axilla superiorly. So now I'm using a ball probe to try and get the free edge of the uncinate as well as trying to find where my maxillary os is. And once I've gotten the maxillary os, I use the hanging technique taught by Dr. T. N. Jankiram sir to me, where I dislocate the horizontal portion of the uncinate and then I use a Toby's backbiter to take two bites at the junction of the vertical and the horizontal uncinate. And once we do that, we get a glimpse of the maxillary os which we have opened widely. And now, as you can see, I'm using a true biting forceps to remove the horizontal part of the uncinate. So you always open the maxilla as wide as possible posteriorly. And now I have everted the polypoidal uncinate process and also gotten the glimpse of the bulla with its attachment to the lamina peperacea, and hence I can confidently debride the vertical portion of the uncinate process. So uncinate process has mucosa, bone as well as mucosa, and as you can see, after debriding the mucosa, I have gotten the vertical portion of the uncinate, and you could also see a glimpse of the mucosa lying behind the bone. And as mentioned before, I am now debriding of the posterior limit of the maxillary os and opening it wide and debriding the uncinate, but you always ensure that you leave a bit of the uncinate, that is the superior most edge of the uncinate, to find or guide you towards the frontal sinus outflow tract. So this is how you define the middle turbinate and get landmarks for FESS surgery. Thank you for watching.